So in dentistry, chronic pain and post-surgical pain are almost exclusively due to inflammatory process. Inflammatory pain responds better to anti-inflammatory medications, which do not include narcotics. Narcotics should be used for extreme pain in a very select and very limited circumstance, almost none of which apply to dentistry. So I think in the example of a TMD pain, there's absolutely no need for narcotics whatsoever because TMD does not reach that level. Anti-inflammatories, perhaps mild muscle relaxers are appropriate. Narcotics are never appropriate for a TMD patient. As far as post-operative pain, if we're talking about general dentistry, if we're talking about fillings, crowns, even minor extractions, this is inflammatory pain. There's a very specific pathway in which this pain develops, and it is relieved by eliminating or reducing the inflammatory pathway. So the medications used should be the ones that are hitting the source of the inflammation. Now, as we move on to acute pain in dentistry is almost always relieved by a relatively quick procedure. It may not eliminate the entire problem, but the most common source of that is pulpal involvement, and a pulpotomy or pulpectomy can be done easily within 20 or 30 minutes at the most, and then after that you're onto the post-operative pain, which does not require narcotics. If you have a patient with acute pulpal pain and you just can't do anything for them, then the appropriate thing is to refer them to someone who can. Regarding the use of over-the-counter drugs to combat post-operative or chronic pain in dentistry, the combination of the NSAIDs, the most common one being ibuprofen, at a level of between 400 and 600 milligrams every 4 to 6 hours, combined excuse me, with acetaminophen or Tylenol of a dose of about between 325 and 500 milligrams, combined with the ibuprofen every 4 to 6 hours, has been researched and very well documented to give the equivalent pain relief of a Vicodin ES, which is 7.5 milligrams of hydrocodone, and or 5 milligram of Percocet, which is oxycodone, without any of the accompanying side effects of the narcotic drugs. Fortunately, over-the-counter drugs are efficacious for almost any type of dental pain. So the studies are very clear that in combination, the NSAID drugs, the most common one being ibuprofen, in a dosage of 400 to 600 milligrams every 4 to 6 hours, combined with acetaminophen or Tylenol in a dose of between 325 and 500 milligrams every 4 to 6 hours, give the equivalent pain relief of either a Vicodin ES, which is 7.5 milligrams of hydrocodone, or a Percocet, which is 5 milligrams of oxycodone, without any of the accompanying side effects or any addiction risk at all.